Welcome back to Business Boone, a product of the Boone County Chamber and hosted by Deep in Talent Strategies. I'm Shauna Lake.
And I'm Lauren Byram. And today we have Chelsey Winters, who is the Associate VP of Health and Wellness at the YMCA of Greater Indianapolis. So welcome. Thank you for being here today.
Thanks for having me.
Yes. So today we are super excited to talk with you about the critical intersection of childcare and wellness, particularly in our evolving economic landscape right now, and how companies and businesses can kind of navigate that.
Yeah.
One thing that we like to ask all of our guests before we dive in is, if your life was a movie, what would it be titled?
I would say it would be like a choose your own adventure, write your own ending movie.
Okay.
I feel like I haven't followed a typical pathway. I'm in a season with lots of little kids at home as well, and so just sort of an adventure every day.
Yeah,
with that.
I like that.
Never a dull moment.
You
then.
got it.
It's exciting.
Yeah.
It's exciting. Well, again, thank you so much for being here. This is a very important and timely topic, so looking forward to the discussion. But before we dive in, can you tell our listeners a little bit about you and your background?
Of course.
And your role at the YMCA?
Yeah, so I have served at the YMCA of Greater Indianapolis for about 16 years, mostly in our healthy living pillar. So all things health and wellness. I have a particular interest or background in sort of the intersection of wellness and what you think about at the Y in terms of recreation and accessing fitness, and sort of public health and more of an upstream approach to health outcomes. But really the trajectory of my career has all been focused on health outcomes and really improving health outcomes. My background is in kinesiology, exercise science, and so I've sort of expanded from there. And as we'll talk today, really now focus on our sort of social drivers of health and some of the upstream work that we at the Y know is so critical to thriving, healthy communities.
Yeah. So that I can feel like I know that there's a lot of businesses and owners and companies that don't see maybe the correlation between childcare and wellness and healthy living with their workforce, but there's a huge intersection. So can you kind of talk to us a little bit about that and what the YMCA is currently focusing on in that space?
Yeah, what we understand at the Y, and again, this is not just the Y alone, right? Many working in sort of this intersection of public health and community.
Sure.
What the data is pretty clear on is when you talk about health outcomes and improving health outcomes and quality of life in communities, really that's predicted by what we call social determinants or social drivers of health, right? So the community conditions and social context in a community actually make a difference in terms of health outcomes. There's about 5 buckets and 22 factors. I won't get into those details. You can Google it, right? But one of those main buckets of what predicts health outcomes is actually education and childcare, right? So this idea that parents can, or caregivers in general, right, can show up their best selves at work when they have quality, consistent, affordable, safe childcare.
Yeah.
We know at the Y, and again, many in public health know, there's a really clear intersection in that. It helps support the kiddo, right? We know 0 to 3, pre to 3, if you will, makes a big difference in their life outcomes and life expectancy, but it also makes a difference for the caregivers who want to and need to get up and go to work every day and have a safe place for their kids to play, grow, learn, thrive themselves while they're at work.
Thank you.
I too have a vested interest in this topic because I have three littles at home. It's a big thing that I don't think we talk about enough.
For sure.
Yeah. Can you elaborate on how the current economic situation is really impacting this conversation as it relates to the workplace?
Yeah, what we talk about often in public health is the choices you make are really predicted by the choices you have available to make to you. So when you look at Indiana as a whole, there are clearly pockets where we've got some limited access to childcare, right? So anytime there's less providers, less access, less spots, right? You said you've got little ones at home. How long were you on the wait list to get your little ones into preschool, daycare, right?
Yeah.
So just literally the number of spots available impacts whether or not families have a choice to enroll in high quality programs. We've also seen some changing landscape in the child care voucher space in Indiana. So about a month ago, there was a reduction in the percent of reimbursement for providers for families who are on a child care voucher. that's naturally going to play a role in terms of supply and demand. And when you impact providers and what economics and finances are coming in, it could impact the number of spots available. And just in general, right? Affordable childcare is hard to find.
Yes.
And so when we've got economics at play and families trying to figure out how to pay for this and that, sometimes childcare and expensive childcare, families start to weigh the data of, is it worthwhile to work outside of the home and pay for childcare, or is all my paycheck going to childcare? And that certainly weighs into a decision for families to make as well.
Yes, and we do recruiting quite a bit, and sometimes we wish there were more people in the talent pool.
Exactly.
That would help fill some of these critical positions.
Yeah, exactly. Childcare workers, right, is certainly a pipeline we continuously work on at the Y, and lots of providers. Again, it's a environment that is a difficult, like, break even perspective, right? And so really thinking about how do you recruit childcare workers, how do you upskill and engage them. It's really meaningful work, but as you know, it's hard work also, right? And so that certainly weighs into availability of daycare spots, right?
Yes.
So as somebody in HR who helps support operations and business leaders, what are some key indicators that we should be monitoring or business owners should be monitoring to determine if childcare challenges are affecting employees' health or well-being? Like what should they be looking at?
So in the workplace wellness perspective, right, we always hear things like productivity, efficiency, engagement, number of PTO or sick days, all of those sort of quantitative metrics. But I feel like really you have to pair the qualitative metrics here, right? What are business owners doing to really get a pulse of how their employees are doing, how their family life is? Do they have childcare? And so I think considering as an HR leader, yes, take those traditional quantitative metrics that you work on and focus on, but how are you really making sure you're collecting sort of more that anecdotal qualitative measure? Do you have a survey? Do you have focus groups? Is there an opportunity for you to engage your employees and really understand the challenges they're facing in terms of childcare? And quite honestly, I would even add in elder care as well, right?
That's a big one.
There's a care crisis at both ends of the continuum in this country. So it's not just about young families with little kids. It's also about workers you have who might be caring for an elderly family member as well. And so I would encourage HR leaders to be really thinking about, how do I collect that person-centered data? Because that may not show up in the quantitative metrics. If someone's struggling to find after-school care, or if someone's struggling to get their kid to school and get to work on time, it may not show as clearly in the quantitative data you would typically collect in HR. So how do you pair that with more person-centered approaches to data collection?
That's great.
Very good advice. You can't learn everything from a simple survey.
Right.
Yes. Can you share some real-world examples or programs that you've seen at the YMCA of Greater Indianapolis that have improved childcare support or impacted employee wellness programs?
Of course. I say all the time, and I don't sit in HR, I sit in healthy living, right? I always say to HR, like, they didn't even pay me to say this. But as a mom of young working kids, I think the Y does an incredible job in this space. We provide to our members something called Play and Learn. That is drop-off childcare. It's available for our members 2 hours a day. Actually, as a Y member, you can actually use it when you're not in the building for a small fee as well. That's a benefit that's offered to our employees as well, right? So when you've got a lot of folks who work varying schedules at the Y, they may not need full-time childcare, but a few hours here and there might help them piece together childcare to be able to be productive and engaged at work. So that's one strategy we use both for employees and for our community at the Y. And then, of course, we offer a plethora of full day care. We have Schools Out Camp, so look at your local Ys, schedule when your kids are out of school. There's a good chance they offer a Schools Out Camp to cover that break. We offer, of course, summer camp. We also offer before and after school programs as well. And we have 7 locations that have full-time licensed preschools. So we're really thinking intentionally about those needs in community and that sort of continuum at different ages of care. And those are all benefits that we provide to our families as well. So Y employees have discounts on those services. Again, we're unique. We are a childcare provider as well. And so I realize we have a little bit of an opportunity to sort of leverage that benefit we offer to community towards employees, but it may give other HR leaders some thought that it may not have to be a full-time childcare on site. There's other pieces of that care gap that you might be able to solve for that still help alleviate some of that burden for your employees.
I know in one of my past lives before Deep End, I worked in manufacturing, and one of the things that we looked at was actually having a daycare on site, partnering with a different organization to come on site, but it didn't end up happening. But what particular steps could an organization take that would support childcare and incorporate, having safe childcare and wellness in their approach as a business?
Yeah. Well, on the Y side, we would love to partner.
Yeah.
Our strategic plan very clearly centers partnership and collaboration. When I talk about social drivers of health and some of these upstream, big picture root causes of poor quality of life, those are not things that any one organization, including the Y, can solve alone. So if there's a Y in your community, I would encourage you to reach out. It doesn't have to be the Y. Think about what childcare providers, what wellness providers already exist. And I would encourage businesses to reach out and talk about partnership, right? It doesn't have to be, let me do this alone in the silo of my business. There may be pieces that partners can pull together and make more efficiently available for you than you doing something on your own. I would also say, in the public health space, we often talk about big P societal policy change, but there's also little p policy, which is those internal organizational policies. So if you can't quite make the math work on your own on-site childcare, maybe doing a review of your other policies that may or may not support families, wellness, time to work out, right? Is there a chance to carve out a hybrid or flexible work arrangement? Really looking at your paid leave structure, both for family leave and caregiving, but also for sick time. So employees aren't coming and spreading germs at work and are taking time off. If you work in a space where there's access to physical activity, what does it look like to encourage folks to spend, 30 minutes to an hour of their day actually working out and being active? So I think there's some little p policy sort of changes that you can look at from a systems level and start to sort of stair-step and implement, even if you can't take a swipe at on-site childcare exclusively for your employees, right?
That's terrific. I think you've addressed some of the anticipated shifts that, or maybe shifts that we did not anticipate as it related to kind of remote and hybrid and work environments. And you've talked about some things that are unique to the YMCA of Greater Indianapolis. But for non-Indianapolis listeners, are there some universal steps that organizations could take regardless of size or industry to better align childcare support and employee well-being?
Yeah, I think again it starts with making sure you have good data, and that's both quantitative and qualitative. So if you're not already engaging your employees and listening to their needs, that would be a first step, is figure out your baseline, figure out where you're at, and then start to make a strategic plan towards improving it, right? None of these things are things that are going to happen overnight. They're things I think a lot of employers of lots of sizes across this country would love to implement. And so start to sort of bite off one or two of those policies a year, make sort of that strategic employee-centered wellness approach and figure out how you can leverage your brokers and your providers and your partners to sort of make steps in the right direction for your employees.
Great. Thank you.
Yeah.
It's been very good advice. And I think it really did address some of those links that people don't immediately think about related to childcare, workplace issues, and wellness. And hopefully now people do see the link a little bit more clearly.
Yeah, there's such an interconnected component of health and healthcare. People often think it's just going to see my doctor regularly, and in reality, that's about 10% of someone's health. The other 80 to 90% are all these things we talked about today. Societal conditions, workplace conditions, what you have access to. The intersection of all of those really drives health outcomes, and in the employer market, driving health outcomes means happy, productive, healthy
Yeah.
employees, right?
Exactly.
Absolutely does.
I was talking to a group last week, and I mentioned that I can't believe I used to say this early in my career, and I was trained to tell new hires to leave their personal problems at the door. And I really feel so bad that I said that out loud, and I realize how ridiculous that is now, because we all bring our whole selves to work every day.
Yeah, at the end of the day, regardless of the industry you're in, we're all working with humans, right?
Yeah.
And so taking that human-centered approach, which again, in public health we're trained to do, is so critical and actually ends up moving the data, right?
Yeah.
It moves
Exactly.
those more quantitative metrics when you take that person-centered approach.
Exactly.
Sure does.
Yes. So, Chelsey, what is something that you know now that you wish you had known earlier in your career?
Good question. You know, my mom, like probably many moms, I grew up hearing patience is a virtue. And she would often then joke, or I would joke, yeah, one that I don't have.
Yeah.
I have learned, especially with this sort of upstream systems work, a lot of patience, and a lot of the things we talked about today are not things that are earth-shattering rocket science, right? A lot of business owners would say, yeah, that's great, but how do I do that, right? The math is not mathing, the numbers don't work, we've got all these priorities, and so I think I've learned in this space of really working upstream that sometimes it's just a matter of the right timing, right? It could be something that we plant a seed 5 years prior, and that partner comes back, and that's the right timing. And so I would say patience and timing is everything in terms of some of these sort of upstream changes that we want to make.
Great advice.
It really is.
Thank
yeah.
you.
So for our listeners who maybe want to chat more about how they can impact their employees and their healthy living, how can they get a hold of you?
Yes, we would love you to reach out. Again, I sit in the healthy living space. I have colleagues that are amazing in the childcare space. You know, my email address is cwinters@indymca.org. If you go to ourcausesu.org or indymca.org, all of our contact information or a way to contact your local Y is there.
Okay.
I think any of the Y leaders in the greater Indianapolis area and really around the state and probably country are happy to sit down, chat, and talk about partnership and collaboration, because that, just as much as healthy people, is what makes communities thrive, right?
Thank you. Thank you so much for this great conversation.
Yeah, thank you.
It's been great.
Yeah, it's been wonderful to have you, Chelsey.
Thanks for having me.
And we will be back with more great conversations. Until then, continue leading.